Platelets, also known as thrombocytes, are special blood cells with an important function. Platelets control blood clotting, which means they are critical for healing wounds and stopping bleeding. A normal platelet count is 150,000 to 450,000 platelets per microliter. A low platelet count can put you at risk for uncontrolled bleeding. It is also possible to have too many platelets in your blood. This leads to a potentially life-threatening condition related to abnormal clotting. What platelets do? Platelets get their name from their appearance. They look like tiny, colorless plates. When a blood vessel tears, platelets stick together to form a clot, plugging the tear to stop bleeding. Platelets are one of three types of blood cells. Red blood cells and white blood cells are the other types of blood cells. Platelets form in the bone marrow from cells known as megakaryocytes. Platelets form clots through a multi-step process that includes adhesion. This is the first step in which platelets rush to the site that's bleeding. For example, if you cut your finger and rupture a blood vessel, it will bleed. To stop the blood flow, platelets within that broken vessel start attaching to the site of the injury. They then send out chemical signals for more help. Aggregation. In the next step, more platelets answer the call and begin to connect to each other to form a clot. Coagulation. As platelets build up at the site of the wound, they seal up the blood vessel in what's called a coagulation cascade. A structural protein known as fibrin joins the platelets to knit the clot together. Fibrin is what forms the scab on a cut. Aspirin and some non-steroidal anti-inflammatory drugs, NSAIDs, inhibit normal platelet function, which is why you may be asked to stop using them for a period of time before a surgery or procedure. An overview of platelet disorders. What causes low platelets? If the body doesn't have enough platelets circulating in the blood, you may develop a condition called thrombocytopenia. This occurs when your bone marrow makes too few platelets, which means you're at greater risk for bruising and prolonged bleeding that takes a long time to slow down. You may need medical treatment for this condition. The following are some factors that may contribute to low platelet count: chemotherapy or radiation therapy. These treatments suppress or kill off the blood-producing cells in your bone marrow, leading to low platelet production. Viral infections. Hepatitis C or human immunodeficiency virus, HIV, infections may attack bone marrow, affecting thrombocyte production. Autoimmune conditions. Platelets may be affected by conditions such as lupus, an autoimmune disease that affects many different tissues and organs, or immune thrombocytopenic purpura, ITP, a condition of low platelets. Pregnancy. Hemolysis, elevated liver enzymes, low platelet count syndrome, better known as HELP-P, is a condition that may occur during pregnancy. It's a type of preeclampsia characterized by high blood pressure and may result in the breakdown of blood cells and platelets. Medications. Anticoagulants such as warfarin and Lovenox, heparin, may stop platelet production. Other examples of conditions that may cause thrombocytopenia include having a mechanical heart valve, chronic alcohol use disorder, liver disease, severe sepsis, a life-threatening infection, and toxic exposures. What causes high platelets? If the body has too many platelets in circulation, it may be related to one of two conditions. Thrombocythemia. This occurs when the bone marrow makes too many platelets. If you have thrombocythemia, you may have other blood cell disorders. Thrombocytosis. This is a high platelet count caused by another pre-existing condition. Disorders that may contribute to high platelet count include the following. Primary bone marrow disorder. Essential thrombocytosis is a condition in which the megakaryocytes, cells that make platelets in the bone marrow, produce too many platelets, increasing the risk of blood clots. Chronic inflammation in the body. Inflammatory conditions such as rheumatoid arthritis, RA, an autoimmune disease attacking the joints, and inflammatory bowel disease, IBD, Crohn's, and ulcerative colitis, which affect the digestive tract, may result in high platelet counts because the bone marrow makes more white blood cells and platelets to combat cellular damage caused by inflammation. Infection. Bone marrow cells increase the production of white blood cells and platelets to help fight infection. Iron deficiency anemia. Reactive or secondary thrombocytosis may result when the body is undergoing a breakdown of red blood cells. The bone marrow cells go into overproduction to meet the body's needs. Spleen removal. up to 1/3 of platelets are stored in the spleen at any time. Removing this organ causes a greater number of platelets to stay in the bloodstream since they can't be stored in the spleen. This is usually a temporary condition. Cancer. High platelet counts can also be seen in cancer, especially with gastrointestinal cancer, as well as lymphoma, lung, ovarian, and breast cancer. This may be caused by inflammation related to cancer. In addition, a temporary increase in the platelet count can happen after major surgery or trauma. Testing and your platelets. Your doctor can assess the numbers, size, and health of platelets using a complete blood count (CBC) test.